Since my last update, the data that we have available to us indicates that COVID infections continue to fall and to fall quite sharply. The surveillance information suggests that in England, about 1 in 35 people have had new infections in the early part of the month of May. This is also borne out in information that we have that comes through the regular testing of care home staff and residents, and also the testing of people who are admitted routinely to hospital who are tested for COVID on admission. All of these data indicate that the background rates of COVID infections are now very low. There's also indication that the level of protection due to vaccination is good. We have high rates of vaccinations, particularly in people who are over 50, but of course there is room for improvement. And to some extent, the most important thing that we can do at this stage to ensure that we remain protected is to be up to date with our COVID vaccination status, whatever category we may fall into, to ensure that if we're eligible for boosters, that we ensure that we are up to date with those as much as possible. COVID is a global pandemic, and we know that this virus can give rise to variants and subvariants that from time to time may cause increase in infections and may indeed change the risk profile. At this stage, there is no indication that there are any particular variants that are of concern at this stage, but that can change. So as we return to normal to some extent, it's important to still remain alert as to what's happening in the world of COVID. It has not completely gone away. And also to think about how we might ensure that we are protected not only from COVID, but from many of the other infections and threats that we have learned to live with over the years. I must give tribute to the public health teams, both working within the UK Health Security Agency and here in Torbay Council, who continue to do that vital work of looking out for those threats and managing them, alerting the public when there is a need for us to take additional measures to control any emerging threats. So I encourage us that as we go into what we hope will be a busy and productive summer, that we ensure that we continue to do all those things that will protect us, protect our families, protect visitors who come into the Bay, and that we look forward to the autumn period when we may hear more about certainly flu vaccination campaigns and whether additional boosters might be necessary for certain groups of people with COVID. We have been through quite a lot with the pandemic, and although we can't declare that it is now at an end, there is some positive development in the fact that we are now past the emergency phase, and we are now beginning to deal with some of the long-term impacts of the pandemic, which will remain with us and which will continue to affect our health and care systems for many months to come. So although background rates are low, the effects are still with us, and we continue to work effectively and in partnership with our NHS colleagues in ensuring that our vaccine programs continue to be available for those who are eligible, and that we are doing all the work necessary to protect those who are most vulnerable as we emerge from this phase of the pandemic. Let's continue to do all that we can to be up to date with our vaccination programs and to be alert as to what's happening in the world of COVID, so that as we return to normal life, we can still remain vigilant to respond quickly to any new threats that might emerge.